why hospital births increase your chance of tearing. Give me a minute and I will tell you why you're more likely to tear if you give birth at the hospital and what you can do about it. Now, for being here today, I would love to offer you my tearing cheat sheet. This is something that you start in pregnancy. In fact, you can start step 1 today to greatly decrease your risk of tearing. If you're interested in that cheat sheet, just let me know and I would be happy to get that to you. Again, we're going to talk about why you're more likely to tear at the hospital in today's video and what you can do about that. If you don't know me, my name is Kristen and I am a pregnancy coach. I work with mamas all over the world. I help mamas have a healthy pregnancy and prepare for a safe, smooth birthing experience. I'm bringing you regular videos that give you an actionable tip in each video that help you prepare for your baby's beautiful beginning. Okay, let's dive into what is it about hospitals that makes it much more likely that you tear. The first problem with a hospital and a doctor is that you're very likely to get very little information prenatally. Yep, in fact, you probably only get the basics about how childbirth works, and those basics are given from a totally mechanical, male-oriented, doctor-oriented perspective. In other words, it's almost like you're a car. They're going to crank you open and then they're going to deliver your baby. A car, a pizza, I don't know, but it doesn't really seem like a woman and a baby and birth. That simplistic model completely ignores much of the complexity, the beautiful complexity of birth and your strength, power, and control over the entire process. In fact, birth is a hormonally controlled process. Many procedures in the hospital circumvent those hormones, stop them, and the problem is not only do those hormones relieve pain and keep labor moving along, but they help to produce softer tissues and they help you give birth naturally. Additionally, if you have knowledge prenatally about what to eat, about how to condition your body and your tissues in a proper way, then you're much less likely to tear. So one of the big problems with hospitals is this: they just don't tell you anything, and then you don't know what you don't know. You know what they've told you, and that's it. And there's really a lot more to discover about how you can prevent tearing, and many of those things, like I said, nutrition, conditioning, and that sort of thing, need to happen while you're pregnant. Another problem in the hospital is what's called Valsalva pushing, or the Valsalva maneuver, which is when you've seen it because it's in all the TV shows, it's on all the movies. It's when the woman holds her breath and squeezes and she pushes and pushes and pushes and her eyes are bulging out and her veins are bulging out and her legs are up in stirrups while she's mostly on her back in this kind of weird semi-sitting type thing. And the problem with that is manyfold. Number one, it's super disempowering. The only advantage of that position is that it gives your doctor a great view of what's going on down there as your baby is emerging. But you're having to push your baby uphill. Your tissues are stretched and much more likely to tear. In addition, the Valsalva pushing with the veins bursting out and everything is not normal oxygenated breathing, even for birthing women. If we were to go back and look at birthing women giving birth in ancient times, that's not how they were doing it. So women are not able to breathe naturally, and therefore there's lower oxygen for mother, lower oxygen for baby, lower oxygen for the uterus, lower oxygen for the tissues. Lower oxygen all around does not equal a smooth, gentle, easy birth. It actually equals a birth where you're much more likely to tear. So the Valsalva maneuver and the pushing position that you're in when you're in that Valsalva pushing, all of those things increase the likelihood of tearing. There are also some other positions that we would think are good, like a full squat, that can increase the likelihood of tearing as well, which is another reason why that education component is so important. And then the final big problem with the hospital is forced pushing at 10 centimeters. I could go on and on about vaginal exams, which I won't do here. You really don't even need them. But in the hospital, you're getting them all the time. And many women feel excited when they get to 10 centimeters for good reason, because then you're done, you're open, you're ready, you can push. But the problem is many women don't feel the pushing sensation at 10 centimeters, or some women will be almost there because it depends on your care provider's fingers and different bodies. You know, it's not a uniform standard 10 centimeters that's being measured by anything with absolute precision. So some women will feel pushy a little before, and some women will feel pushy after. So one of the things that happens when the baby just moves down and even comes back up a little bit without forced pushing, instead mom is pushing when she feels the urge, is that pushing might take a little bit longer, but the baby moves down and the tissues have a chance to stretch. In addition, when there's not that forced pushing where the pushing is extended to the count of 10, but rather goes with the contraction, there is the likelihood that baby's going to come back a little bit and then move forward a little bit. And it may feel discouraging, though most women universally describe pushing is feeling empowering. I'm one of those women who at first I didn't find it that way. So if you're not, definitely get you there, girl. But most women enjoy pushing, and most women like the break that they get between pushing contractions. I certainly did, and it gave me a minute to regroup. And what was happening down there, or what is happening down there, is your tissues are being given the ability to stretch. So choosing mother-directed pushing and pushing in positions that favor you and not necessarily your doctor's view of what's going on are going to be really good. Your doctor can get down on the floor and catch, and you will see many midwives do that. They choose the funkiest positions because women choose the funkiest positions and babies choose the funkiest positions. But really, it's about what you and your baby need for a gentle birth. So prenatal conditioning, good positioning, and pushing when you want to, all of those things make a huge difference. Now, like I said, I would love to share my tearing cheat sheet with you. It goes over some of these things you can do prenatally and reinforces things that you can do during your birthing time to give birth over an intact perineum without any tearing. Just drop me a line below and I will be happy to get that to you, and I will see you soon.